Virginia Garcia was a 6-year-old child who came with her migrant families to Oregon. She traveled from Texas, Mission, Texas, came by California. She cut herself, cut her foot. Then they came to Oregon. In Oregon, she got worse. They brought her down to Hillsborough to see a doctor, was sent back with medication to the camps, and ended up dying at St. Vincent's Hospital the next day. But with her death came the clinic. So Virginia Garcia started in a little 3-car garage and started providing health care to migrants.
Creating a change, a very positive change that has impacted the lives of thousands of people in our communities.
Virginia Garcia Memorial Health Center fills a vital role in our community health care system. I've worked in a number of communities across the country in the past 35 years, and no one has anything quite like this except here.
Not knowing whether, if their child is sick, whether they can bring the child to a doctor, whether a doctor will be there who speaks their language, who understands their culture.
In 30 years, we have gone from a small clinic in a garage to the clinics that we have now. And we have also changed the population that we serve. We are serving the Latino, Hispanic population in Washington County and Yamhill County, but we also serve the uninsured and the Medicaid population. We see the Vietnamese, we see Somalians. We have grown to accept all cultures and be able to see them.
Almost 100% of our provider staff speak Spanish. But in addition, we also have some staff who speak Vietnamese, Cantonese, Somalian. If people don't speak those languages, then we employ interpreters through interpreter services to speak Russian, Farsi, many of the other languages.
Dental Aid for Children had closed down, and the Washington County Dental Society had also closed down. So there were no places for children to go for dental in Washington County. If a child doesn't receive proper dental care, it affects his ability to learn, to grow. If he's not treated since at the early stages of, baby bottle, let's go back to when they're born, then, when baby bottle tooth decay starts to take effect, they don't develop properly. It becomes important for them to have a place to go. It's the only low-income clinic in Washington County, and again, it's a county that's underserved dentally.
Virginia Garcia really provides an array of outreach services, parenting classes, our diabetes classes, classes that address weight loss and good nutrition. We provide outreach services for people in the migrant camps, where we are literally visiting the camps on a weekly basis with a nurse and a health promoter.
Well, my first child that I brought to the clinic was actually 3 kids, who one of them works here at the clinic now.
Maria was working for the school district, and she brought us, our first backpack, our first tennis shoes, and, got us started in the school system. And later on, let us know about Virginia Garcia back then as well. And we were patients as migrant children. We were patients of Virginia Garcia. It's been a big service for us as a family to have grown up with Virginia Garcia. I manage Virginia Garcia Dental Clinic, and it's an honor. It's a great circle for me. It's been a way to provide something back to the community. It's a way that I can say I can help a child that I was once, that same child. I understand what it's like to live in a labor camp, to pick berries, to live a family of 10 in a single cabin. I can relate to that.
I'm here because I'm a migrant, because somehow Virginia Garcia and I are together. you know, that she and I, she's my spirit and I'm hers. If Virginia Garcia was not here,
Kids wouldn't be getting well child checks, diabetics wouldn't be getting routine care, pregnant women wouldn't be getting prenatal care.
I cannot see it. I cannot see Virginia Garcia not being here.
The vision for Virginia Garcia and for our community really is that no one in our community lacks basic healthcare services, primary care services.
All the providers, not just the providers, the nursing staff, the front office, really everyone is here because they're committed to the mission of the clinic.
And so I don't consider this a job anymore. I don't consider this work. I just consider this my mission, is to get those people that really need to get in, try to help them through the system. And if I can do that for one person, at least it's one person. I can't help everybody, but at least I can get one person at a time.
There is still a lot of work yet to be done.
Over the past dozen years, I've seen Virginia Garcia quadruple in size and services in Washington and even into Yamhill County. And yet there are still tens of thousands of residents in this area who need services and need help. There's more to be done. Partnering with them and other community organizations like the County Health Department, the Essential Health Clinic, and others, we're going to get it done.
Together we can make a huge difference in the lives of vulnerable people in our community.